Good morning, and welcome to another edition of Columbus Concerns, a public affairs presentation of North American Broadcasting. I'm Mark Nuce. Thanks so much for joining us today. With us is one of our old friends, the president and CEO of LifeCare Alliance. Chuck Gehring is with us. And Chuck, thanks so much for coming in today.
Well, thanks for having me. You put an emphasis on old there. Old friends.
Long time.
Long time
friend.
Okay.
Let's put it that way.
Yes, okay.
For those who have never heard of LifeCare Alliance, or they've heard of it, they're not sure what it is, tell us a little bit about exactly what LifeCare Alliance does these days.
Well, our main mission is to serve seniors and medically challenged through nutrition and health care. We're the big Meals on Wheels provider. In fact, we're one of the three largest in the country, and we're the only one in 5 counties. So if you're listening to this, we're in Franklin, Madison, Champaign, Logan, and Marion. But we're also do home health care, nursing. We have wellness centers. We've taken on the Columbus Cancer Clinic in past years through a merger 12 years ago, believe it or not, the oldest free cancer clinic in the United States of America. We have Project OpenHand, which assists those with AIDS in our community in a nutrition program and other such things. And we've got a new project now.
And tell us about the new project.
Well, we just took on the Central Ohio Diabetes Association. They're 52 years old. They're a wonderful organization, one of the most respected organizations in Central Ohio. And they chose, and we wanted them to, and they chose to merge into LifeCare Alliance. So that happened. We signed the papers the end of January and just announced it the 1st of February or so. So it's brand new. And Central Ohio Diabetes does 3 main things. They do detection services, so you've probably seen them around the community checking you out with a drop of blood to see how your glucose is. Very important. You know, so many people as they age and become more sedentary develop diabetes. In fact, about 60% of the Meals on Wheels clients we have diabetes, believe it or not. Mm-hmm. So it's a super thing. Secondly, they do a lot of health education to help people learn how to live with diabetes, which is very critical, especially with youth. A lot of kids get diagnosed at a very early age, so it's important that they learn how to manage it. Diet and exercise are the key things. And then the third thing they do, which is celebrating a 50-year anniversary this year, is summer camp called Camp Hamwi. HAMWI, and that is up. They take the kids from all backgrounds and all economic circumstances, and they go to camp for a week or two, and they learn basically at ages 7 through 17 that they're not alone, that they are not the only people with diabetes, and they're not the only people carrying little bags, refrigerated bags to school with them and things like that so that they can get their insulin or whatever it might be. So what a wonderful thing. They, like all our programs, service people. We're not researching. We're not trying to cure anything because we can't. We do try to prevent as much as we can, and we really work hard to prevent these situations. But the trick is that we really want to be able to help people through it. Diabetes, like cancer, AIDS, and many other health issues that we take care of at LifeCare Alliance, are debilitating financially to people.
Yes.
When you get them and you can't work or something changes in your life like this, if you're on the edge anyway, you are really on the edge. And one of the things we're very proud of at LifeCare Alliance is that in the 15 and a half years that I've been hanging around the place, I will tell you, we've never had a client that we are aware of that has had to go into a homeless situation while they were under our care. And that's something we're very, very proud of, and we think that's very important. On the diabetes side, with CODA, as they're known, Central Ohio Diabetes Association, shorten it up to CODA, as opposed to COTA, the bus, CODA, diabetes. I would tell you that it's just critical that we get to the folks. It's something that can be prevented. There's been a lot of studies and a lot of results lately. Mm-hmm. That people that are on the cusp, now you can't always prevent it because if your body's not making insulin, it's not making insulin. But if you properly eat and you do proper exercise, weight loss, things like that, you can really prevent the need for these drugs and stay off. People have been on insulin, have gone off insulin in some cases. So it's not a universal cure, but it's really something that can be prevented. And that's what I think LifeCare Alliance is all about, preventing the need or preventing hospital stays, preventing homelessness, things like that. And we're very fortunate to add them, and we think they'll be a great addition to our programming for our clients and their clients too.
Our guest on the program today is the president and CEO of LifeCare Alliance, Chuck Gehring. And Chuck, what is it that LifeCare Alliance does well that the Central Ohio Diabetes Association saw and said this would be a good merger?
Well, I just think taking care of people. They looked at us and realized how many of our clients had diabetes. Mm-hmm. We have 15,000 active clients right now at LifeCare Alliance, which means if you're active, you got one thing from us last week, at least one thing. We have 50,000 in the database because we have a number of them come and go depending on need. Like you may need us for a little while, but then we get you better. You know, Meals on Wheels shows that after you're on our Meals on Wheels for 90 days, you really improve dramatically and oftentimes could get off of them and take your life back.
Right.
So it's important, again, that's prevention. So they saw that and said this is a good partnership. You know, there are other groups out there that raise money for research, which is super too. But none of our groups are researching. None of us are raising money. The money that we get does not go to a national to do research. If you want to do research into diabetes, there are groups you can send your money to. But a lot of people have issues, as to where that money goes, what the real outcome of it is. Will my $25 make a difference type of thing? And it does, certainly. But there's a growing group of people that say, hey, what can I do in my own hometown? Mm-hmm. And really try to help somebody who's in great need. And we see the response with people that have tragedies in their life and they have these, fundraisers and things, and people just respond incredibly. And that's kind of what they saw in us and we saw in them. So we are there. All our programming is to help somebody and prevent the need or to help them through the need. It's not to research and cure it. And I don't know. I guess someday some of these things may be cured. We may cure cancer. We may cure diabetes. Certainly AIDS is something that is manageable now. Mm-hmm. It's not the death sentence it was 20 years ago, which it was a death sentence. And cancer is horrible, but it's less of a death sentence than it was. They can fix a lot of stuff. They can't fix everybody, though. But so people want to help people through this time. And, when they get into a homeless situation, you just don't get out of it generally. I mean, it's just impossible to get out of a homeless situation. So it's important that we keep you out. And I would tell you, when you hear this, if you're listening to this, when I talk about keeping people out of homeless situations, you're thinking, okay, they're all very poor, which is true. We get the part-time, 25-hour-a-week fast food employee, but we also get a lot of people anymore from the suburbs.
Yeah.
And that's what people don't realize, that, if you're a couple, you probably bought the house on two incomes. Based on two incomes, or you're renting a property based on two incomes, and you lose one of those incomes because you get a health issue of some sort or whatever happens. You just can't work for a while. You slip and fall and break a leg or something. You're in trouble.
Right.
And so we've been seeing, especially since the recession in the mid-2000s, 6 and 7 and place at times like that, we've just been seeing an increased number dramatically from the suburbs. People that are saying, I never thought I would be at a food pantry.
Right. And so many people these days also, if they have a medical problem, they also have very high deductible insurance because that's the way the insurance industry is going.
Yes, or they have no insurance. We see so many people on Medicare and Medicaid anymore. Medicare is pretty good insurance. Medicaid is tough because it's a low pay, and a number of healthcare providers will not accept Medicaid. I always use as the example, and I just reprinted this article for my board. It was from 2010, so a ways ago now. But the article was in the Dispatch, and it talked about the fact that they were reporting that the Cleveland Clinic, one of the real bastions of healthcare in this country wasn't taking Medicaid anymore.
Yeah.
And so and we see that not as much in Central Ohio. The hospitals in Central Ohio are super about taking anybody, and they've been really good about that because we do a lot of the back end work for them and things like that. So we do save them money. And also I would tell you, Mark, that our services are designed to keep you out of the hospital.
Yeah.
And our clients average about a week less in the hospital than the Ohio and national average, which is huge cost to taxpayers. Think through that if Medicaid or Medicare is paying for it. And who wants to go to the hospital? And trust me, the hospitals are thrilled with this too because they're full. I mean, they can't take any more people. And so it really becomes a very difficult situation. And you don't realize this if you have good insurance. Because if you have good insurance, you can go any place you want. If you don't have good insurance or you have minimal essential coverage or you bought the Affordable Care Act's bronze plan or something like that, which is better than nothing, but you just can't get to people, and some people just won't take you. Medical providers just won't take you, and we see this all the time, and it's very frustrating for us and trying to get people the proper care. But we also have, I would tell you, some people in this community who understand this, and medical professionals who will take people for free because they just want to help out. And we don't have enough of it, but it's really something that is very important, and we appreciate all their help with this.
Before we continue the interview, Chuck, how can people get a hold of LifeCare Alliance and get more information?
Well, if you are a potential client, just call our main number, which is 614-278-3130, 614-278-3130, and the person answering that phone, that's all they do is talk to people about the services. So if we don't offer the service, we'll get you to the people that do offer the service. But we offer a lot of stuff. If you want to volunteer, you can still call that number, but let me switch you over to a different number. If you want to volunteer for us, and we live off volunteers, especially in the Meals on Wheels program, we have the hotline, 614-444-MEAL, M-E-A-L, 444-MEAL, M-E-A-L, and that's on that big purple sign that you see on 71 South, just south of the split. You can also go to lifecarealliance.org. Although we know many of our critically ill or senior fellows don't use a lot of internet, so don't use a lot of computers. So feel free to call, and we'll hook you up as best we can.
I know it's always been your goal not to have a waiting list for Meals on Wheels, which is very common around the U.S.
Yes.
Is that still the case?
It is still the case, believe it or not. I was praying in 2016 at the end of the year, we're on a calendar year end, that we were going to make it to not lose money last year. We were on the cusp, but and probably lost a few bucks, but we'll be okay. We do not have a waiting list for any of the services I described, and our shtick is, and our goal is not to do that. We try to take everybody and figure out how to pay for them. It has become very difficult. That's why we always need more volunteers and supporters, but we continue to do that. And I would tell you, in examining the United States on the Meals on Wheels program alone, we are, of the top 50 markets in the country, population-wise, we are one of about 3 or less, because I'm not sure they're all doing this, without waiting lists right now. So in many parts of the country, if you call in and say, hey, I'm getting out of the hospital, and I need some support because I can't get to the store and things like that, I have no help. In most parts of the country, in big cities or small towns, if they even have a program, they say, hey, it could be 6 months to a year before we get to you. Well, you need the service the next day. In Central Ohio, we're still blessed that we can get to you the next day. And I would tell you 40% of the new clients come out of the hospitals.
Yeah.
So you're in the hospital for some reason. You're normally able to take care of yourself, but you've had some issue. You get sent home, and hospitals have to send you home at some point, and you need help, and we'll take you usually, and if you qualify, and go from there. So we're very fortunate here in Central Ohio to still have that, but it's getting tougher and tougher as the numbers continue to grow.
Boy, I guess over the years, Chuck, do you have any clue how many thousands of people you've helped keep out of nursing homes because of your services?
Well, it's hard to say that. It's kind of like saying we knew that we kept Mark from having a heart attack last year, you know.
Right.
And it's tough like that. But we know that Franklin County, which is our bedrock, has the highest percentage of seniors living in their own home of any county in Ohio. And you would think that would be in some rural county somewhere.
Sure.
It's Franklin County. And I can tell you, when you look at the stats, clearly we have kept out or delayed entry for literally million people maybe over the years. We've been around since 1898, so I got 119 years of history here. So if you do the division, but and it's not that, and nursing homes and assisted living homes have their place. My mom, unfortunately, with horrible Alzheimer's disease, spent the last couple of years in her life in a beautiful nursing home, and they did a super job for her because she had to be watched constantly, make sure she didn't fall out of her wheelchair. And you sometimes get to that point, but for a lot of people, they don't get to that point. And again, frankly, the nursing homes are full.
Sure.
Find a bed sometimes. So people want to stay in their own home as long as they can. So that's our goal. That's the mission, is to keep you independent in your own home. Saves taxpayers huge dollars. If you're a taxpayer listening, which I think everybody is.
Yeah.
You save just ARP calculates over $65,000 per person per year, because if Medicaid's paying for you to be in a nursing home, it's you're paying for that in your taxes, and nobody wants it. You'll hear when they're trying to balance the budget, the Ohio budget, you often hear the governor say more in-home care, more in-home care. They do whatever they can, and that's just how it is these days. So we're trying to do that, and we're being very successful with it. But going back to 1898, I think we've helped a lot of folks over the years. And I would tell you, I said earlier in the program that we currently have 15,000 active clients, which means you got something from us last week. That number was 10,000 actives at the end of 2010. At the end of 2015, it was 15,000, and by the end of 2020, it's going to be 20,000. You just see them grow every year. It's unbelievable. And Central Ohio is not a place people move out of. We're not Rust Belt. People are moving into Central Ohio and staying here. So we're going to have increasing numbers, and we got to just keep being able to take care of them.
So, Chuck, with LifeCare Alliance now helping not only Meals on Wheels, but cancer patients, AIDS patients, people with diabetes, there is a great need for volunteers, as you mentioned. So what type of volunteer work is available for people who want to help? And
just to be clear, while we've taken on these other agencies that are specific to those diseases, we have one of everything. In fact, I have learned over the years about diseases I never knew existed.
Yeah.
There's one called Turner's syndrome. I'll just tell you, we have a client with that, which is locked joints. It's very advanced arthritis, and look it up. It's unbelievable, and the debilitating nature of this. So we have one of everything, but we need volunteers. The big thing is delivering Meals on Wheels. You can do that. If you're a business listening to this, it's one of the great employee retention and attraction tools out there, and I can prove it to you if you call me, and I'll talk to you about it. But it's unbelievable. You let a couple of employees go out at lunchtime while they were going to go out anyway and deliver meals. You deliver them around your business. It's phenomenal. We are the only Meals on Wheels provider in the state of Ohio still delivering 365, not just most are Monday through Friday. So if you want to deliver on the weekends, you can take your family, you can take kids. I'll tell you, kids just love it. Going with parents and grandparents, it's a fun thing to do. I always tell people on the weekends, Saturday, Sunday, or holidays, what a great thing to do for a date. If you're looking, it costs you nothing but a little time. And the guys listening out there, you will be a sensitive new age guy if you take your friend with you on a date to deliver Meals on Wheels. You will get a lot of points for that. But we need people like that. We also need people to come and work on our pantry, which is specific to our pantry is the weird one in the Mid-Ohio Food Bank system. You have to have active cancer or active AIDS to use it. We have people come down and help at client events because we try to do things for our clients constantly. We just had a Valentine's Day party that was unbelievable for our folks and some of our clients. We bring them in. So there's a ton of volunteer. You can work front desks at screenings. You can do all kinds of stuff. And CODA, Central Ohio Diabetes Association, always needs nurses and dietitians to work the summer camp for kids.
Well, Chuck, we are completely out of time. So once again, with the time we have left, give us the phone numbers, not only if you need your services, but if somebody wants to volunteer.
If you need a service of some part, or you just want to see what's out there, you call 614-278-3130 or go to lifecarealliance.org. If you want to volunteer, you can call that number, but please call the volunteer hotline, which is 614-444-MEAL, MEAL. And we appreciate if you do get an answering machine, somebody does call you back pretty quickly.
What a blessing to have them in our community, LifeCare Alliance. Chuck Gehring, CEO and President, thanks so much for being here today.
Thank you.
And you've been listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. If you have any questions or comments, you can drop us a line at 1458 Dublin Road, Columbus, 43215. I'm Mark Nuce. Thanks so much. We'll see you again next week on Columbus Concerns.